Hi, I'm Dr. George Weiss, and I want to welcome you to Spa 858. I'm going to take you into the spa, and I'm going to show you some of the procedures that we're going to be performing today. We're going to be doing things like Restylane, Botox, laser resurfacing, hair removal, etc.
Hi, I'm Jennifer. I'm one of the registered nurses here at Spa 858, and today we have one of our patients, Debbie, here. And we're going to talk a little bit about, you've done Botox in the past, and what are you interested in today?
Well, a couple things. I really don't like the fake look. I don't like when someone looks, I'm young, I'm 30, and so I don't want someone to know that I have gotten that. So I want something that's going to just be really subtle, but also make the...
And have some
wrinkles.
movement.
Yeah.
Perfect. What we noticed, and when we talked when you started with the Botox, is we see a lot of younger girls because we want to prevent those wrinkles from becoming what we call static, where they're there all the time. Okay. So go ahead and raise your eyebrows for me. So I can see there's just a little bit here yet that's a little bit concerning to you. And we can definitely take care of that, yet still giving you a very natural look and natural movement. Debbie's concerned with her smile lines. As you can see, as we get a little bit older, the cheeks start to drop just a tad, and it sort of brings over a shadow in this area. And hold that smile for me. What we can see here is where the nasolabial fold is starting to drop a little with the face. We can actually easily fix that with many different fillers. So what we're going to do is just use a little bit of filler in this area. It's actually going to give it some volume, plump that out for you. It's going to give you a very natural look. The other great thing about fillers, there was a study done that shows that it actually will help you reproduce your own collagen to fill in that area. So it's something else that people are doing when they're younger. Debbie also has one more concern, if you don't mind me telling them. It's a very small little leg vein, but as you can see, Debbie is very athletic. You're a Pilates instructor, and she has gorgeous legs, so we can easily take care of that for you with one quick sclero injection. So we'll get you all set to do that. Sound good?
Thank you. Yeah.
Well, thanks for coming in, Debbie.
Thank you.
Appreciate it. Hi, Patty. How are you?
Really fine, thanks.
Good. Well, today we're going to be doing IPL. We're looking at your face today, and what we talked about is you can notice a lot of things. Now, you say you're a native of San Diego.
I am a native.
And that means you've gotten a lot of sun throughout your life. Now, as we're younger, our skin is very, very clear, but as we get older, a lot of this pigment does come up to the surface of the skin. So what we're going to be doing is actually reversing that process. So what the IPL does, it actually penetrates the skin, looks for that pigment, and actually will break it up. That pigment will come up off the face, and it will leave you with a clear skin.
I'm excited because I have to wear more and more makeup as the years go by to hide all the flaws and the little red veins that are coming up, and so I'm really looking forward to this treatment.
That's what we find quite often. Women will start wearing more and more makeup, and it actually makes them look older. It starts getting stuck in the crevices and the little fine lines and wrinkles. A lot of women nowadays, they use lightening creams, your hydroquinones for instance, and actually it can take up to 2 years to get results that I can do in just one treatment with the IPL.
Great, I'm looking forward to it.
All right. Another thing that I've noticed is some of the broken capillaries and blood vessels. IPL is very good. It targets that redness, and it also helps with tiny spider veins in the face, telangiectasias. The other thing that IPL can do is it actually can build up your collagen. What that's also going to do is help with the fine lines and wrinkles. Once we're done with your treatment, you're going to look fabulous. You're my favorite kind of person.
Thank you.
For those of you new to IPL, I'm going to explain how the process works. First, we prep the patient's skin with a very light cooling gel. What that gel does is it protects the face and cools off the skin. This is the actual IPL head that we use for treatment. So we actually will just apply this to the face, and we do gentle pulses of light.
Genevieve is here for Botox, and Genevieve is, you're less than 30 years old, and what I wanted to show people is that even though you're not 50 or 60, you can still have some premature lines in aging. And one of the concerns, tell me if I'm wrong, is that people think that you're constantly angry when you're really not. So show me your frown lines, okay? And now lift your eyebrows. Wow, look at that. That's incredible. That's exactly the kind of thing that we can really take care of. See, she's got these incredible lines and muscles that are contracting forcefully, and it's an easy thing for me to do. Just inject with Botox. It'll soften her up. It'll make her look a lot younger. This is a woman who's almost 30, but she's already starting to have a little bit of that harsh line because of the frown lines that she's developing, and you're a Pilates instructor, correct? So she does a lot of activities, and she has to look a little bit more refreshed for her clients. And it is the perfect way for us to be able to Botox her forehead and her frown lines, and it will soften her up. But in addition, it will also prevent this premature wrinkling and aging that is already beginning to show, as you can see. So let me see that. There you go. As you can see, it's called the 11s. Another thing that she was complaining about is these little bags under the eyes.
You know what, actually, people always ask me, did you get enough sleep last night? Are you tired? And really, it's a way to say, you look awful. And I'm really tired of it, completely honest.
And you know, this is the typical thing that happens. She's barely 30, but because she's an athlete, she's outdoors and indoors. And as we start aging, some of that fat pad starts to drop, so we get a little bit of that hollow look under the eye. We develop the bags, but then we also lose some tissue. And with the proper fillers, such as Restylane or Juvederm or one of those newer fillers, we can actually fill in the tear trough and give it some volume. This is the volume that you start to lose as we start aging after the age of 30. And with a little bit of help, you're gonna take 5 to 8 years off of your face, and it's gonna make you look much more refreshed. And she is a perfect patient for this. She's a perfect candidate actually for this kind of a procedure. As you can see, she has this little hollow in here. All I have to do is drop a little bit of this Restylane in here, and it's going to make a huge difference. Now, a lot of people are afraid to do this, but she is perfect, and just a little bit will go a long way. So we can actually put it in here, and it's going to make a huge difference. Okay, and we're gonna numb you up, and then we're gonna do the procedure a little bit later.
Okay.
And right now we're gonna start probably with the Botox first.